Gestational diabetes. In this video, I will talk about what it is, how it's diagnosed, signs and symptoms, risk factor for mom and baby, and management, including diet, exercise, and blood sugar levels. Gestational diabetes is a type of diabetes that occurs only during pregnancy. The stomach converts food into glucose, and glucose enters the mom's bloodstream. The mom's pancreas produces sufficient insulin, but the insulin is resistant. Glucose can't get into the blood cells, causing high glucose levels in mom's bloodstream. High glucose levels in mom's blood enters the baby through the placenta. The baby pancreas makes more insulin to handle the excessive glucose. Gestational diabetes affects the mom in late pregnancy after the baby's body is fully formed, but while baby still is growing. Since the baby is getting more energy than it needs to grow, the extra energy is converted to fat, causing baby to weigh more than normal. Gestational diabetes can cause problems for the mom and baby during delivery. The baby may be delivered cesarean section and may also have breathing problems. As the baby grows older into adulthood, the baby may have diabetes or obesity. How it's diagnosed. Gestational diabetes is not a pre-existing condition, but with an acquired disorder. It occurs because of the body's inability to tolerate glucose. It usually presents itself anywhere from 20 to 28 weeks. Glucose tolerance testing is done at this point during pregnancy. So I just did this appointment for my pregnancy, and what they give you is a glucose drink, and they also call it glucola. It has a certain amount of glucose in it, and for my case, since it was my first time and I hadn't failed, it had 50 grams of glucose in it. I didn't have to fast, and blood was taken before, just so they could see the difference. Blood is taken before, and then blood is taken also after, and they want you to fit within this frame just to see if you have gestational diabetes. So the level of 140 or greater, then they do a second test. With the second test, it's a 3-hour test, and 12 hours of fasting and 100 grams of glucose is then given. Fasting blood draws at 1 hour, 2 hours, and 3 hours. Fasting should be 95 milligrams over deciliters, and at 1 hour, 180, 2 hours, 150, and 3 hours, 140. If 2 or more of these are met, the patient is then diagnosed with gestational diabetes. The signs they look for is polyuria, polydipsia, and polyphagia, including weight loss. A lot of these signs go unreported because these signs are just signs of normal pregnancy. On this slide, you would catch the risk factors for mom and a mom that has gestational diabetes. Those risks also. So you can go ahead and read through those. Risk factors for fetus and newborn: congenital anomalies, including heart, central nervous system, skeletal system. Large gestational age greater than 9 pounds at birth leads to macrosomia, IUGR, respiratory distress syndrome, hypoglycemia within 2 to 4 hours of birth. And in this picture, you can see the difference between the large gestational age baby versus a normal size baby. Management. Blood glucose monitor will be done daily with meals. Diet and exercise can be used to help control. Weight gain should be monitored as well. Education on lifestyle changes should become a priority postpartum. And on this side is the recommended diets that mom should try to have in her diet. That's the end of that. Thank you for listening, and hopefully you obtain information that you already know about gestational diabetes. Here's the references. And then question. A mother 38 weeks with gestational diabetes gives birth. Which characteristics might the newborn display? A. Small gestational age. B. Large gestational age. C. Fetal anomalies. Or D. Cyanosis. The correct answer is B. Newborns may appear large due to the increased blood glucose, leading to excessive growth and deposit of fat in newborn. Next question. Gestational diabetes is diagnosed through which process? A. 18 weeks gestation through amniotic fluid. B. 12 weeks gestation through finger poke. C. 20 weeks gestation through ultrasound. Or D. 24 to 28 weeks gestation using glucola. The correct answer is D. Glucola is used to help diagnose gestational diabetes. The drink should be drunken an hour prior to blood draw. And that is all for this video. Thank you for listening.